Hello, Dr. Sean Woods back here with the Healing Vibe. Today we're going to talk about the mouth and the teeth. In last video we talked about the mesentery, so go back and review that if you need to. So really digestion starts with the mouth and the teeth, but actually in reality it actually starts with our thoughts, because we can just think of some yummy food and our stomach starts growling and digestive juices start going just through thoughts. So that becomes an important factor as we get further into this. But your mouth and your teeth is critical, because many times I fixed several people just by getting them to chew their food again and to take a pause and to breathe a little bit in between bites, because if you don't chew your food enough and it hits your stomach, over time your stomach gets kind of mad at you. It gets all knotted up, it gets overused, and eventually just downright stops digesting food properly. So the mouth and the teeth become critical. There's an enzyme that the glands around the jaw and the face produce. It's called amylase, and amylase is a digestive enzyme that basically digests just carbohydrates. So it starts to break down the sugars that you eat, so that by the time they eat your stomach, that process has already started. Now, if you had enzymes that broke down proteins, which are proteases, and you had enzymes that broke down fats, which are called lipases, we'd actually digest ourselves. So the beginning of the digestion of those begin lower down in the stomach, and the gallbladder starts to do those other two forms of digestion. But chewing your food and getting that amylase into the food can be critical many times for the digestion of your carbohydrates, because if you don't do that, over time you can have overgrowth of yeast and other things that start to show up in the stomach and the first part of that small bowel, because carbohydrate digestion just did not happen when it should have. And also the teeth are critical. The teeth become critical because those are avenues into the body. So in my book, The Healing Vibe, I go through all types of maps on how the body is connected. And one really cool one is the tooth chart, which if you kind of look closely in there, you'll have to get my book to see it further, is every tooth is connected to an organ, and there's multiple organs connected to teeth. And you've probably heard of this before, if you went to the dentist or to your oral surgeon and they gave you an antibiotic after they treated you. Well, because they know that bacteria can go from a tooth right to a heart. But believe it or not, these teeth, you can have bugs that are in your microbiome in your mouth, from parasites to different viruses to different yeast. Those bugs can travel from teeth to any organ of the body. It's not just the heart. So it's more complex than that. And we'll talk more about that when we talk about embryology and how our body is first forming, because that's when these pathways are first laid down. So very, very important to keep the teeth and the gums clean, because they can be an avenue for many diseases inside of the body. And also the teeth are kind of critical, because although I've been able to reverse osteoporosis and osteopenia in people and have been able to get people to grow more strong bone inside of their body, I've yet to see people regrow teeth. So once you start losing teeth because of cavities and decay, you're really not going to grow those back. And their teeth are always a good indicator on how your overall body is doing anyway. So when you start the process of digestion, my first recommendation is start to chew your food slowly. Some people say 20 or 30 chews. I don't think we have to be that extensive, but make sure you take your time, breathe in between bites, and chew your food properly and swallow so that food gets into your stomach in the proper form. And the next thing we'll be talking about is the stomach. So stay tuned.